Welcome. I'm Barbara Marcum, the Director of Senior Resources for the City of Westland. As we are at the center committed to education, we do also work outside the center, and we work with Madonna University, both the nursing class and the service learning class. Today we have some of the student nurses who have been working with us all semester, and we're going to talk a little bit about arthritis. So, Abir, let's talk about arthritis. What is arthritis? I know it's a general term, but what is it?
So, as a definition, it's the inflammation of the joint. So it can affect one joint or multiple joints, and there are many kinds of arthritis. The most common ones are rheumatoid arthritis and osteoarthritis, and millions of people around the world and in the United States have arthritis. It's a very common disease.
Abir, what are the causes of arthritis?
So if we want to talk about the causes of arthritis, we have to talk about the type. So the causes of arthritis are dependent on the type of arthritis. So we're going to start with rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease. That means that your own immune cells that are supposed to protect you against foreign bodies such as bacteria get confused and start working against your own cell bodies. So a lot of causes, genetics plays a role in there, and also smoking, lifestyle. So, and also women are more at risk than men, and that doesn't mean that if you have these risk factors you're going to have rheumatoid arthritis, but these are like general risk factor of the disease.
Mm-hmm. And what is the other kind of arthritis?
So the two most common kinds, as I said, are rheumatoid arthritis and osteoarthritis. So there are like 100 types of arthritis. These are like the most two common kinds.
Well, and as you get older, I'm sure the risk increases.
The risk, yeah.
Because we see a lot of that.
Especially an older adult, yeah.
Yes. Okay, so how do you know if you have rheumatoid arthritis?
So rheumatoid arthritis is a systemic disease. What does that mean? It means that it can affect many parts of your body. Generally, it's at the joint where you see like stiffness, pain, and loss of function at the joint, and or it can be like general fatigue or skin rash. And if it's more severe, it can affect the other body organs like your lungs and your kidneys. So it's a very serious disease, and you should seek medical advice as soon as you are diagnosed with rheumatoid arthritis.
Yeah, and there are specialists who deal just
Definitely.
with rheumatoid arthritis because it can actually be very debilitating.
Yeah. Yes.
So how are the symptoms of rheumatoid arthritis managed? Once you find out you have it, what are some of the best things to do for that?
Yeah, so for rheumatoid arthritis, there are two things you can do. Things you can do at home. For example, like exercise, like heat and cold therapy, like warming up your joint before starting your day. And there are things that, and there are medications. These medications are a very important part of rheumatoid arthritis. So they are called the DMARD. This is like a group of medication that you have to take once you are diagnosed with rheumatoid arthritis. Especially that I said it has a lot of complication and it can affect a lot of body organs. So these medications lower your risk of getting these complications from the disease.
Yeah, it's pretty scary. It's a scary
thing. It is a very scary.
But they can test for that pretty early in life if you have an R factor. Yeah. So even if you don't have the symptoms yet, knowing ahead of time can really, help prevent some problems in the future.
Yes.
Mandeep, let's talk about osteoarthritis. Is this the most common kind of everyday thing that like seniors get?
Yes, it is osteoarthritis. It is very common, especially in the older adults. Mm-hmm. In the USA, like 12 million people are affected by osteoarthritis, especially people older 65 years and older.
That's pretty significant.
Yes,
number.
It's a big number, yeah. So basically what it is osteoarthritis is a wear and tear type of arthritis. It can cause by many conditions, but mainly it's affecting your joint.
If it's wear and tear, I imagine athletes have to be really careful about their joints throughout life if they do that for a living. If it's wear and tear, then it would seem that they were probably really at risk. But is that one of the causes, is just a lot of activity?
Right. So even though it's damaging your joint, but managing the symptoms can really help. So it can preserve your function as much as possible. So the main causes are like, repeated trauma to your joint, like a diabetes disorder, obesity, or like any hormonal disorder.
How do you know? I mean, if it lasts for longer, I mean, how do you know? Are you stiff? How does that present in a patient?
So osteoarthritis is mainly affects your joints like your knees, your hip, your hands, and spine. So if these joints are affected and you're gonna feel like you have pain in the joint, stiffness, you cannot like function, like the loss of function, and also like you're gonna feel very warm at the joint.
Oh, okay. Is it important to exercise? Is that one? How do you manage that? Is exercise important for people who have this arthritis?
Yes, it's very, very important. So for, as Abir mentioned earlier, for the rheumatoid arthritis and the osteoarthritis, for both type of arthritis, it has to be like you have to stay active. So keep moving your joints. It's going to really help, and it's going to help to relieve the pressure of the affected joint. So even like small things in the morning, like when you're waking up in the morning, try to stretch your joint and kind of like warm the joint, and then start your activity, just like before you doing anything else. And some people feel like during the cold weather, they're like more stiff. They feel pain. It sometimes it affects the weather, but like mainly it's due to the barometric pressure. When it changes, the weather changes, they feel.
I can attest to that.
Right. But usually you're gonna feel pain. So pain is the main cause.
No, do they normally prescribe like over-the-counter things like Aleve and Tylenol? Does that seem to help with arthritis?
Yes, it does. But then you can also, like when you feel the pain, you can see your symptoms like it's getting worse. So it's better to get the advice from your doctor. And then also you can. It doesn't mean like if you're older you're gonna feel pain, but it doesn't mean like you have to live in the pain, right? So there are like some ways you can still like do at your home, like exercise, like putting a heat on a joint and just relaxing the joint. And as you mentioned, the common medications like over the counter, the Tylenol and the Motrin, they're very common to use in the the osteoarthritis. And you can find them over the counter, but it's important to talk to your doctor first, like before taking it, because many other products are available over the counter and has Tylenol in it, and most people don't realize, and they are most likely to get overdose. So we don't want to be this happening.
People don't think you can get too much of a medication, and there are side effects to acetaminophen and liver damage. So if you take it too much, or you take it or drink alcohol or different things, you can get in trouble that way. So it's always good to go to your doctor.
And also something with that is some medication interact with other medications. So if you're already on like a certain kind of medication, you can't just go and get over-the-counter medication. That can be like a very serious issue. So.
Yeah, and it's important too, like so many seniors have different doctors. So you go to some doctor for your arthritis, and then you go to a cardiologist, and then you you get different medications from doctors. It's very important that you have a list and you give it to each one of your doctors so that they know what you're taking. What is the difference between osteoporosis and osteoarthritis?
Yeah, so these are basically two terms. Most people get confused.
They do.
Right, so it's very important to know the difference between these two. So osteoporosis it just means your porous bone. So which it means the density and the quality of the bone is reduced. So many people do the bone density test, and also as you get older, your bones becomes fragile and porous. So the risk is you're more likely to get fracture, and you don't even realize it. You don't get any symptoms, so it's asymptomatic.
It doesn't cause pain like the joint pain would be.
No, yeah. So it just happens, like, and the fracture happens, and you realize it. Something's wrong with it, right? So
some seniors actually, they think for lots of different reasons, and some are hereditary, some are, style of and things that happen, diet and everything else. But some people, when they fall, they think, oh, you break your hip, and often the break occurs before you fall. So, to have a bone density test and kind of know where you're at is really a good thing. So, so the difference, the osteoporosis really is the bone loss and the fragility of the bone as you age, and then osteoarthritis is
it's just the inflammation of the joint.
The inflammation of the joint.
Right,
so that's easy to kind of to differentiate.
Yep.
So
what is helpful in preventing osteoporosis?
So as you just said, osteoporosis is the disease of the bone. So anything you do that strengthens your bone helps in preventing osteoporosis.
What might help?
So exercise, swimming, walking, these kind of exercise that don't put so much pressure on the bone but still strengthen the bone.
Use it.
Swimming is a very good one. Aerobic swimming is a very, that one is also good. And then, for example, diet, such as like drinking milk that has both, that is fortified with vitamin D. So milk fortified with vitamin D has both calcium and vitamin D, and they're both good for your bones. And also, since we live in Michigan and we don't see the sun so much, and vitamin
especially
D,
in the winter,
especially in the winter, and a good source of vitamin D is the sun. So go to your doctor and check your vitamin D levels, and then if you need it, you might need like supplementation. So that's a good thing too, and generally like lifestyle and diet. And you can
a good balanced diet,
yes,
lots of fruits and vegetables and protein and calcium.
Yeah.
It's funny because everybody now with the sun, people are afraid, don't go out in the sun as much as they should. You should get at least 20 minutes of
they say 15,
light a day.
Yeah, and they say also like even if your hands in the sun, it's still enough. Just get this like 15 minutes a day sitting in the sun. So especially also, it's a good thing to say here, women are more at risk for osteoporosis than men, so it's very important.
Well, it's always good to know, and it really helps people to know, what to expect, what it is, and how to prevent it, and if you can't prevent it, certainly how to deal with it. So thank you both for being with me today, and thank you, viewing in the audience, for being our guests.